IPC Health is a community health organisation. We deliver services across the western region of Melbourne.
Community health, what that means is we deliver all of the services that a person needs, from GPs and dentists all the way through to mental health and social supports as well. So we look to support the whole person.
We're also a large employer, so we have just shy of 600 employees who are really passionate and talented and focused on providing great client outcomes for our community.
The client is at the centre of everything that we do. Client objectives, client goals, client outcomes, client experience. That's our primary focus.
I'm really excited about the Well for Life strategy. It's all about keeping people as well as they can be. Eat well, sleep well, drink well, play well, live well. That's what Well for Life's all about.
We want to provide holistic services in a really sustainable way. How does our strategy help us achieve this?
For me, holistic services is about integrated care, right? And integrated care is a big change. Most people, they'll go to the doctor or they'll go to a physio, whereas what we want to do is deliver team care.
So they might come in with a condition or an ailment, and if they see one of our wellbeing coordinators, we might end up providing other services to them, either internally at IPC Health or referring them to external services.
One of the real focuses of our strategy is to make sure that we tailor what we offer to the needs of our very diverse community, so that they actually get access to services that work for them, possibly for the first time in their lives.
And that Well for Life strategy is looking at prevention, intervention, education to empower our clients to become more in control of their healthcare, so it's not escalating to a point where they need to go to hospital.
Our upstream approaches are having great impact. Our Diabetes Connect program, for example, 43 clients prior to entering that program had reported visiting an ED in the previous 6 months. Since joining their program, that number has declined to 1. That's real impact with tangible benefits for the healthcare system.
So our growth strategy is really basically about surplus for purpose. We aim to make a surplus in our services where we can, so we can reinvest that back into areas where the funding is more limited or where people are really struggling to access the services they need. The approach we take is to start small, help people understand what the change looks like, and gradually scale up from there as people get more comfortable with the different way in which we want them to work.
We need to grow the organisation and grow that surplus so that we can deliver more.
So our workforce strategy is about our staff being well at work. It's about us enabling a really creative, diverse, safe workspace so people can come to work and be at their best and really be set up for success. We have a whole range of professional development and career pathway opportunities for staff. Whether you're a student or a graduate or someone who's been with the organisation for 30 years, we have something that's for you.
We want you to feel really supported at work, and that's what the Well at Work and Well for Life strategy is all about. With our new strategy, we're going to need a number of enablers in terms of technology, systems, different ways of working.
We're definitely focusing on improving the way that our clients interact with us. At the moment, a lot of the onboarding and referrals are sent to us on paper, or we fill out paper forms, and we're looking to move all that to a digital platform.
We don't want our qualified health professionals spending hours a day doing admin work. What we want them to do is to spend all their time working with clients and for clients at the very top of their skill sets.
Whether that be in a clinical sense of how we interact with our clients, whether it be in the digital space, the technology that we're leveraging, all our efforts and energy are focusing on improving that experience for the clients.
Our facilities are set up to assist and enable that client-centred work as well. So we've got the right facilities to provide the right care in the right place. And that might well be in our actual facilities or in clients' homes as well. When we're setting up workplaces for our staff, we're conscious that we're providing a nice environment that people want to come to. So a nice kitchen, nice tea room, quiet spaces, collaboration spaces, meeting rooms, a lot of booths that people can have individual or group meetings, and whether they're face-to-face or through telehealth.
At the end of the day, the most important thing that happens is that interaction between our staff and the clients that we're here to serve. And healthy, bright, attractive spaces we know are shown to deliver better health outcomes.
IPC Health has been around for a long time, but there's a lot of people still out there in the community who don't know who we are and what we do. So it's really important that we're starting to communicate those messages further. We are measuring quality of life of our clients. If we can prove our impact, it means IPC Health can attract more funding, which means we can help more people within the community.
Measuring our impact also means we can celebrate the achievements with our staff and really demonstrate the impact that they're having on their clients and our community.
Partnership is really important for this model of care. We can't possibly have all of the services that our clients need, but the way to make all those services available is to partner into that with other organisations, and we're actively doing that right now.
IPC Health is a trusted partner, and we are determined to find ways to deliver better services for our clients, our staff and our local community.
There are so many different ways that you can be a part of this. You can volunteer, you can join us as a student or a graduate, all the way up to our senior leadership and our niche specialist roles.
If you're passionate about keeping people well, if you're creative, you've got some great ideas, and if you really want to make a difference, come and work with IPC Health. We're very determined to deliver this strategy, and with your help, we can do that.